The time is just gone 19 minutes past 9 a.m. on News and Views this morning. And the Ivermectin discussion continues, and it will be for a very, very long time. And this morning, the question that is raised is, could ivermectin be finally approved in South Africa? And we joined on the line by Barend Uys, who is the head of research and development at AfriForum, where AfriForum has now filed papers in the Gauteng High Court against the Minister of Health, Dr. Willem Kize, and also SEPRA, the South African Health Products Regulatory Authority, for an urgent order to ensure that ivermectin developed for human consumption is available to doctors. Barend, good morning to you and welcome to the show.
Good morning. Thank you for the opportunity.
Yes, wonderful having you with us, and we do appreciate your time with us at this point. And we know that, there have been applications by certain doctors with regards to ivermectin in terms of Section 21 of the Medicines and Related Substances Act to have ivermectin approved for the treatment of COVID-19 patients. And I'm sure AfriForum, in taking this matter up, in taking it to the Gauteng High Court, consulting with specialists in the field, a lot of research must have been done before AfriForum has embarked on this course of action.
Yes, most definitely. Of course, we need to recognize that we are in abnormal circumstances, and the reality is that we are losing people every day. We have deaths every day. And in such circumstances, you need to simply do a risk-benefit analysis. And in this case, we are speaking about a medicine. The risk associated with medicines is what is possible side effects. The benefit is, can it possibly help us to fight the sickness? Now, ivermectin has been around for a very long time. We know that ivermectin is a really safe drug when used under the supervision of a medical doctor. And we know that there's been many studies in many countries across the globe that shows that ivermectin has the potential to decrease deaths and to help people recover from COVID-19. And if you've got a safe drug that shows potential to help, and you have people dying every day, then the ethical decision to take is to make the drug available so that doctors and patients can have the freedom to use it if they so choose.
Yes. Now, in taking this course of action and taking this matter to court, obviously, you have discussed this matter. You have consulted with medical specialists, Barend. What are the medical specialists saying?
Well, they, of course, we are saying what they are saying. They are saying what we are saying. If you look at the different studies across the globe, and there's been meta-analysis done on these studies, which I believe now might be into the, let's say, about 40 studies. We've seen a meta-analysis of 27 studies. And every single one of these studies from Argentina, Spain, Bangladesh, India, and I can go on, all of these studies show potential. And if you are a frontline working doctor or nurse and you are losing patients, then of course, if there's something that shows potential, you want the freedom to try it. Of course, on a voluntary basis. Of course, your patients need to also agree if they are in a state, or the family of the patients. But it's really terrible if there's, as a medical practitioner, you think there's something that might help and you are prohibited to use this drug.
Yes. Now, at this point in time, we've seen a resistance on the part of some officials within government. Also, we see certain scientists who are obviously driving this whole COVID-19 project in South Africa, and also SEPRA at this point in time in terms of resistance as far as ivermectin goes. Why do you think they are resisting?
It's a really difficult question to answer. I believe, of course, there might be many answers. The one answer might be that there's a reluctance from health authorities to quickly approve repurposed drugs. And I think it's also because of the experience we've seen in the pandemic. We had specific products, and we can name hydroxychloroquine, where there was a big hype and it was approved for use. And then it was actually discovered that it's not really helping. So I believe experiences like that influences the willingness of authorities to approve. What gives us hope, of course, is that you've got the NIH in the United States that now changed their recommendation on ivermectin to neither for or against the use of ivermectin. Now, that's not a let's use it, but at least it gives doctors the freedom to use. Unfortunately, I believe there's also always, and unfortunately, especially in South Africa, people in the mix that is there not for the benefit of people, but for the benefit of making money. So that can possibly also play a role. Maybe it's simply people not doing their job. I believe anybody that makes a public statement that say ivermectin might not be safe, I would say it's reasonable to say that they might be really misinformed or uninformed, because ivermectin has been in use for decades. It's used by millions of people. And I mean, the inventors of ivermectin actually received the Nobel Peace Prize. So you are telling Nobel Peace Prize winners that their medication that is listed as an essential drug by the WHO might not be safe.
Well, certainly, and we know that the WHO obviously has looked at ivermectin, saying that it is an essential medicine. It has been proven safe. Now, let's talk about this court action, because we know that possibly what is going to, we look at February the 2nd, which is next week.
Yes, that's the day when we are planning to be in court.
Yes, and what is expected?
Well, of course, it's an urgent application, so it's difficult to say what is expected. But of course, we can talk about what we are asking. So we are asking for a few things. Of course, firstly, we are asking for the comments of the Minister of Health, the acting DG, and SAPRA, the comments about the safety of ivermectin to be set aside. And then we are also asking for the approval of the Section 21 applications by this medical doctor for 2 of his patients that are currently suffering from COVID-19. And I think it's sad to mention that there was actually 3 applications to Section 21 applications, and the 1 patient passed. And then, of course, we are also asking some declaratory orders specifically relating to Section 21 of the Medicines Act, and also Section 44 of the Medicines Act, that gives pharmacists and doctors the right to compound medicine.
Now, also, Barend, what obviously doesn't make sense, and it is irrational, is on the one hand, you've got a vaccine that is being pushed, a vaccine that has been developed very, very recently without a proven track record. And on the other hand, talking about ivermectin, declaring it as unsafe. Now, as you mentioned, that ivermectin has been around for a very, very long time. Now, where does one actually make sense of an irrational decision like this?
I think the better way to approach it is to say, let's simply consider the practical facts and let's see what we can do. And the current reality in South Africa is that it will be months before we have vaccines available to, let's call it, to the majority of the citizens. And that means we need to build a bridge between this time and that time. And one possibility might be ivermectin. So we are saying, let's make ivermectin available. Let's get something to treat patients that are suffering and that are sick. We need to remember that the purpose of a vaccine is to prevent. Of course, once you have COVID, a vaccine will not help you recover from COVID. So we need to constantly be looking for medicines that can possibly help us in the fight against the COVID-19 sickness. And if ivermectin shows potential, I mean, we need doctors again. And let me say this: we need to give doctors. They swore an oath to protect people and to help them, and we need to give them the freedom, to give them the tools they need under these circumstances, to treat the patients that they care for.
Yes. Now, I think what is important, as you're talking about, obviously with the doctors taking an oath and obviously taking responsibility when they would prescribe ivermectin for a patient. But on the other hand, and this is something that we've come to learn, that the pharmaceutical companies that are actually producing these vaccines have obviously signed certain deals where they would obviously they will not be held liable in the event of their vaccine not working, or if there are any consequences for patients, obviously, who are given the vaccine. So, again, when we look at the situation where we're talking about doctors and getting doctors to be responsible. The producers of vaccines are not taking accountability, and they are not responsible enough as well.
You see, that is one of the challenges we are facing as citizens, and that is that government is not providing us with information, and so you might know that AfriForum and Solidarity is also busy with legal action relating to the vaccines, and in our minds, that action involves basically two important things. The first thing is we as citizens have the right to have the information what government is doing. They cannot have secret deals and not disclose the information to citizens. So firstly, we've got a right to that information, and they need to supply us with the information so that we can make informed decisions. And secondly, it's the wrong time for government to want to centralize something and want to have a monopoly on the distribution and the purchasing of vaccines. We know that private role players can make a difference. They can help with the purchasing, they can help with distribution, and it's just the wrong time to say we've got this war that we are fighting against a virus, but sorry, we do not want you involved, we do not want your help. It's the completely wrong approach. We need to say everybody that can help, please help. In the right way, of course. Let's put people and the well-being of people at the center of matters. And unfortunately, to use the argument that the only way we are going to prevent corruption is by centralizing. Well, up to so far, this policy of centralization actually led to the opposite. And actually, I think it's internationally known, the more centralizing forces you have, the more likely you are having to have corruption. So, yes.
Yes, and just finally, Barend, as we are speaking and as this matter is going to head to court, we know at this point in time there are people that are taking ivermectin. They are consuming ivermectin. We've heard about ridiculous prices as far as ivermectin is concerned, even to the extent where there are some that are now talking about fake ivermectin tablets that are available in the market. So while all of this is playing out, people are on ivermectin.
Yes, and again, we need to be practical. It doesn't help that we are trying to be unpractical. The fact is that people are currently using, for instance, animal medicine containing ivermectin. This is happening without the supervision of medical doctors. The government and authorities can say what they like. They will not stop people from using it. Of course, I've also heard the rumors of ivermectin compounded for people are also available. Of course, that is, strictly speaking, currently in South Africa, that's illegal. So the selling of that would be illegal. And we're now seeing an impact on the farmer side where the animal medicine is, all of a sudden you see this massive increase in price, and there's even an availability issue. And there's a real risk on both sides. So there's a risk of overdosing because people are using it without the proper supervision of a medical doctor. But there's also the risk of taking not enough. And then you can actually have a situation where the virus can build, where resistance can be built against ivermectin. And the only practical solution to this reality is let's make ivermectin compounded for human use available to doctors so that people can use it under the supervision of properly qualified medical doctors. This is the only practical way to manage this challenge, and that is why it needs to happen.
Well, Barend, let's see what happens on February the 2nd. But as always, we thank you for coming on and your time with us here on News and Views on Salaamedia. We wish you all the best. Take care.
Thank you. Same to you and your listeners.
Barend Uys joining us this morning, and this is ahead of the matter that AfriForum is taking to court regarding ivermectin.